Welcome to the Mount Pilgrim Missionary Baptist Church Network, where we are building faith and transforming lives, where our senior pastor is the Reverend James I. Perkins.
You know, my name is Ike Perkins, and I'm the pastor here at Mount Pilgrim Missionary Baptist Church. And at this time, I'd like to introduce Mr. John Francis. And John, if you will, you can introduce yourself and tell people a little bit about you better than I can. So
Sure.
If you will do that for me, please.
Ike, thank you for the opportunity to be here today. I'm very pleased to be here at Mount Pilgrim Baptist Church. I'm the Executive Director at Helping Hands Clinic, which is just a few blocks away from here. Helping Hands is a nonprofit medical clinic and pharmacy for uninsured adults in Caldwell County. We have about 1,200 patients that we serve. I've been there a little over 5 years now. All of our patients are uninsured. We don't do any Medicaid, Medicare, no billing. The bulk of what we do is chronic disease management, so diabetes, hypertension, high blood pressure, COPD. All of our patients are from Caldwell County, so we only serve Caldwell County. Pharmacy and a clinic, so we do a lot of free meds, plus on-site doctor visits. We're always actively enrolling new patients. So one important thing for me to note today for folks watching, for folks at Mount Pilgrim, is that we are accepting new patients. We have been ongoing. I'm not from here. I'm from Pilot Mountain, which is just a little north of Winston-Salem, but I've been in Caldwell County for about 7 years now.
Okay. Now, do you have any little ones, any older ones? Or?
I do. Two little ones. I have a 6-year-old daughter named Lucy, who is a kindergartner at Davenport. And then my son Harry is 3, and he's going to preschool at Robbins Preschool, which is also
okay.
Far away.
So John, you just getting started then?
Getting started, but also done. I think two is a good number for us.
Well, tell me, John, how did you get to Helping Hand all the way from Pilot Mountain, come through Winston-Salem, Hickory, and into Lenoir? How did you get to Helping Hands in Lenoir?
A very circuitous route. So I went to Carolina. I do not have any kind of medical degree. My degrees are in geography and peace, war, and defense, which I don't know that I'm actively putting to use today, but good solid liberal arts degree from Carolina. Spent a couple years up in Boston, 3 years in Boston, working for an AmeriCorps program called City Year. Most of what they do is working in after-school programs and in classrooms with kids. But I worked with their volunteer engagement components. We would take our corporate sponsors and community volunteers and go to a school or a church and paint murals and paint gyms and build benches and do that kind of stuff. Did about 3 years and came back to North Carolina to work for the Z. Smith Reynolds Foundation in Winston-Salem, which is kind of a social justice oriented grant making foundation from the old tobacco Reynolds family money. Spent a few years with North Carolina Community Foundation and was working in this area, doing some mix of grant making and fundraising for nonprofits, and then got to know Lily Bunch, who was my predecessor at the clinic. And the clinic actually set up an endowment with the North Carolina Community Foundation, so I worked with them some then. And when she was leaving, she kind of called me up and said, "Hey, would this be something you would be interested in?" And my initial reaction was, "I don't think so." But the more we talked about it, I mean, they were looking at someone who had some experience with fundraising, and I knew some of the clinic's donors really well already, and I thought, why not give it a shot? And that was 5 years ago, so I've been blessed to be there for 5 years, and it's been a good place for me and for my family. And Lenoir's been a very welcoming community for us.
That's good. You know, I served on the board for a little while, and I found out a lot about the clinic, as well as a lot about John and your commitment to the clinic and your commitment to Lenoir and to all of the clientele, I think, that go through there, the doctors and everybody. So you're not only blessed, but we are blessed here in Lenoir to have the Helping Hand, but to have a director who is caring about the people, who love the people, and who I can sense that loves your job, love what you're doing. So we in Lenoir, Caldwell County, are blessed too to have John Francis and your family here with us.
And I should have mentioned that. I served a full 3-year term on our board.
I did.
It just rotated off at the end of last year.
Yeah, I had to, some family things that I had to deal with. But John, I know you've talked about this, but how did the Helping Hands get established? What brought that about in Caldwell County?
So we've been around for 23 years, I believe, founded in 1998, and it all started, there's a group 20 years ago, 23, 24 years ago, called Healthy Caldwellians.
Ah.
And I don't know all the history about it, but essentially they were looking at what needed to happen in Caldwell County to improve health outcomes.
Yeah.
And one of the most important things that came out of this was that we needed we needed a better way to serve uninsured adults.
Mm-hmm.
So I don't know what the number of uninsured adults was at that time, but right now there are about 13,000 uninsured adults in Caldwell County.
Oh my gosh.
And the number was probably even higher then. So 23 years ago, Helping Hands started as an all-volunteer effort. We had all volunteer staff, volunteer doctors, et cetera. And it was in the basement. If you know where Medical Arts Pharmacy is, across from the hospital, it was in the basement of that building. At some point around 2010-ish, we moved over to our current location on Harper Avenue, right downtown. We used to say blue awnings, but we just bought new awnings last year. It's a big gray awnings with our logo on it. We moved there somewhere around that time, and we've grown and grown ever since. So a lot of folks think that we're still all volunteer, that we just do referrals, but that's not true. We have 8 full-time staff members. A couple of part-time folks. Yeah. We have a provider, either a doctor or a physician assistant on site most of the time. Sometimes we have 2. So we're seeing patients. We'll do roughly 2,500 patient visits in a given year on site at the clinic. Our pharmacy will dispense probably 17,500 medications this year. So that's the size of a small independent pharmacy. So we've grown a lot over time. Great partnership with the hospital, with Caldwell UNC Healthcare. So we work very closely with them. We have, our patients have access to just about everything they need here locally, and if not, we can send them to Chapel Hill or to other hospitals within the UNC network. So great access to care for our patients. I'll talk very briefly about why there are so many uninsured folks in Caldwell County and in North Carolina in general. So a lot of folks think of Medicare is for old people and Medicaid's for poor people, but it's just really not that simple. Right. So to be eligible for Medicaid in North Carolina, you have to be deaf, blind, disabled, pregnant, young dependents, kids in the home. Obviously not all of those things, but you have to fall into one of these buckets. And so if you're say a single male with no disabilities, the likelihood of you getting Medicaid is really slim. Right. Or even a single female, if you're not, there's you have to meet these criteria. And when the Affordable Care Act was passed in 2009, Obamacare, a lot of states expanded Medicaid, and not only do you have to meet those criteria, you have to be below a very low income threshold. Yeah. So a lot of folks that are working even part time are already above that income threshold. So 38 states, I believe, expanded Medicaid kind of in conjunction with the Affordable Care Act. There are 12 states that did not expand Medicaid criteria, including North Carolina. So there's been back and forth between the governor and the General Assembly, for 10 years now about whether or not we should do that. Yeah. I think, you can make an argument for either side. I'm not, Helping Hands is certainly is bipartisan or not apolitical. We don't do politics, but one result of not expanding Medicaid is that there's still a large number of people that don't qualify for Medicaid and either don't make enough money to qualify. Don't make enough money to qualify for a subsidy under the Affordable Care Act, or the Affordable Care Act premium is still just too high out of their price range. Yeah. So all of our, and none of our folks have access to Medicaid. They all in fact have to get a Medicaid denial letter in order to enroll through the hospital's charity care policy, but they don't have access to Medicaid. They're not 65. We have some folks that are over 65, but by and large, we're 18 to 64. They don't have access to Medicare, and they're making a decision on whether or not to put food on the table or buy the medicine that they need. Yeah. So they're just in this coverage gap through no fault of their own. If they don't have, maybe they're working 30 hours with their employer, and you have to work 32 or 40 to get health insurance. So a lot of these, we estimate that about 2/3 of our patients are working at least part time. So they're doing the best they can to make ends meet, And, we feel like Helping Hands is keeping them healthy, keeping them out of the ER, keeping them out of the hospital,
Right.
keeping them at work,
Yeah.
and allowing them to make, to make better decisions on, do I feed my family or do I buy my insulin?
Yeah. John, and I know this is for all of the citizens of Caldwell, and you just explained who is entitled, but are there any monies exchanged, or does any of your clientele or your patients pay any money, or how is this funded?
So there's no fee. So we never turn away anyone access to care for ability to pay or pick up meds. We do ask for a donation when you pick up meds, $5 when you pick up medicine, $10 when you see a doctor, but that's not something that we enforce.
Right.
It's a suggested donation. So the bulk of my job is raising money each year. So we raise $550,000, $600,000 a year.
Yeah.
And that's coming from churches, it's coming from local private foundations, it's coming from individuals, businesses. We're having our big fundraiser coming up in March, which will be different this year, as it'll be virtual.
Yeah.
But our Pot of Gold fundraiser, we raffle off $5,000.
Yeah.
It's usually big to do. It'll be a lot different this year. We still think we'll do well, and it'll be a good event. But that typically is about 10% of our operating budget.
Mm-hmm.
When you look at we piece together a bunch of different pots of money in order to make it work.
Yeah. Well, I know firsthand how generous Caldwell County can be. We have given away turkeys each Thanksgiving, and Caldwell County has just responded well. Sometimes we would have an overabundance of turkeys to give out to people. So I know firsthand how generous that people in Lenoir and Caldwell County can be. Just got one other question that I thought that we need to talk about is the COVID. I know, as you well know, that it's affected everybody.
Sure.
It's not one group of people, it's everybody. So John, how are you guys handling the COVID, or how do you receive your patients in seeing that the COVID situation this year?
Yes, it's a great question, and we've adjusted and changed and updated and improved our policies and procedures dozens of times since this time last year, or since last March. So we are 100% safety first and have been all along, and we've, if anything, gotten more and more and more strict and in terms of enforcing things and in terms of setting policies to keep our staff and our patients safe. But right now we do a lot more phone triage than we used to. So we really encourage our patients to call if they're having any kind of symptoms before they even come in. Yeah. So we want to make sure if we need to direct them to testing, which the hospital's done an incredible job here with testing, and the health department as well. But we are not testing or treating COVID because we don't need to. We got the hospital and health department doing that stuff.
Yes.
So very early on, we figured out, our niche is still our niche. We're going to keep our patients healthy and out of the hospital. That's what we need to do.
Yeah.
So we have a lot more stuff over the phone, tons of messaging on Facebook. We've sent letters out to our patients a couple different times going over our procedures. But essentially, there's a big sign, one of those big A-frame signs before you even get to the door that says all patients must be COVID triaged. Okay. So when they come in, we built new kind of barriers at the front desk to keep patients a little further back. There's a series of questions around symptoms, and we do a temperature check. Okay. So we do all that when they first come in the door. They all have to be wearing masks, and we've given out thousands of masks. In fact, Ike, if you need some here, we'll probably hook you up. But before they even get back to talk to the nurse, they've been asked those questions. The nurse then asks those same questions, around symptoms, another temperature check, and then the same thing when they see the doctor. So we're pretty strict on that. But we've had about 30 patients test positive, and the bulk of those were in December and January. Yeah. So we're kind of rolling along, having one or two here and there, and then December it was felt like one a day there for a while. Okay. So we've had quite a few patients. We've had I think 11 patients wind up in the hospital. We did have one patient pass away. I mean, when you have 120 deaths in a county this size, everybody's going to know somebody or be connected to somebody that passed away. So we're continue to take it very seriously. We've been helping out UNC Health or Carlo UNC with their vaccine clinic.
Yeah.
So I was actually there this morning. We're not doing anything complicated. We're just helping observe, set the timers, and observe folks when they after they get their shot. Have to wait for 15 minutes. But we're helping out with that. We've, in my thinking, anything we can do right now to help get shots in arms and help get this community vaccinated. I know you've had your vaccine.
Yes, I have. Yes.
So I think it's really important for those watching. I will say that a lot of folks are concerned about the safety and the efficacy of the vaccine. I'm not a doctor nor am I a scientist. I have read tons about this.
Yeah.
I would vouch for it. It's been the mRNA technology has been researched for 30 years. I mean, there's a huge foundation of work and research that went into this before COVID ever came around. So the technology was already been worked on, and yes, it happened quickly, but when you put tons of effort and funding into something, it can happen a little more quickly. Hundreds of thousands of people have already gotten their vaccine across the world. So the sample size keeps getting bigger and bigger and bigger. We've seen some people have fever and don't feel well after the second dose, but by and large, we haven't seen a lot of negative side effects. And the side effects that people do have, often if you feel crummy afterwards, that's not necessarily a bad thing. That's your immune response. That's your body, that's your immune system saying, hey, something's going on here, because they're recognizing these spiky proteins that are mimicking the virus. So it's teaching your body how to respond. So the best thing we can do as a community is get our vaccine as it's our turn. And know they're hearing all kinds of stuff on the news about supply, and there's been all kinds of changes to priorities, but when you have access to the vaccine, I encourage folks watching to get it.
Well, that's good. I do too. I encourage people to get your vaccine. There's nothing about it that is going to hurt us. So I would encourage people to do so. And one other thing, we can't thank our workers, our nurses, our doctors, all of the hospitals, and all of the emergency crews, the policemen, all those guys that each day that put their lives on the line for us. And I'm so glad to hear that you guys at Helping Hand are doing what you can do as far as assisting those that are administering the vaccination or setting up something. So we are blessed to have a community where everybody now seems like is taking a hand in doing what we can do. I just got an email the other day. We are putting candles in our windows to acknowledge and to let the workers know that we are appreciative of what you do. I have 2 in my window, and I would encourage everybody, because you never know what community the workers live in, and when they see that candle, they will know, of course they will know that they are appreciated. So I just want to take this time just to say thank you for what you do to our essential workers, our hospitals, and everything. And John, I can't thank you enough for accepting this time to come and be with us and share with us what Helping Hand is about. I know a lot of people by now should know what Helping Hands is, but if you don't know, you ought to know by now. John, thank you.
Yeah, I will say thank you so much for the invitation, Ike. I really appreciate it. Our website, helpinghandsclinic.org. It's a pretty new website. We're proud of it. We're at 810 Harper Avenue, 754-8565. 754-8565. 754-8565. helpinghandsclinic.org. 810 Harper Avenue. Thank you, Ike. I appreciate the opportunity to be here.
Thank you so very much. And thank you guys for tuning in and listening to us. And if anytime you have some encouraging words, that feel free to get in touch with us. You can reach me at 828-729-5892, or you can tune into us, Mount Pilgrim Baptist, Lenoir, North Carolina, every Thursday at 7 o'clock. Mount Pilgrim Baptist, is that right? Mount Pilgrim Baptist, Lenoir, North Carolina. So thank you so very much, John, and we look forward to working with the Helping Hands, and thank you for all that the Helping Hand does, and may God bless you, and we'll see you again soon.
If you are visiting us here at the Mount Pilgrim Missionary Baptist Church, we would like to say welcome in the name of the Father, the Son, and the Holy Spirit. We open our church to you so you can worship as the Lord leads you. Our prayer is that your visit will be a pleasant one, and that you will experience the presence of the Lord, and will encounter the Holy Spirit here today. Always remember that we here at Mount Pilgrim are the church with the common touch, where everybody is somebody, and God is always in charge. We thank God for your presence today. May the rest of your day and your week be blessed.